Hello, John Atkinson again here talking about circumcision, genital cutting rituals that are performed on children, the genital autonomy movement or intactivism, whichever term you prefer to use. And today I have a friend of mine here, a fellow advocate, and please introduce yourself, Braden.
Hi, my name is Braden. I live in Saskatchewan, Canada. I'm 24 years old. I've part of the intactivist movement for years now.
For how long?
4 years.
4 years. Okay.
Yeah, I was 20 years old.
Great. So what led you into the movement?
I actually went the first 20 years of my life thinking I was born this way because I had never to this day, actually, I still haven't seen an intact male anywhere of any age, at least in Canada.
Wow.
So I thought this is the norm. We're all the same. Must be we're born this way. And I could see like the color difference on my genitals, but I thought it was like a birthmark. I didn't know that was a scar. So and the how this was opened up to me, like how I learned the big truth. In my second relationship, 20, my girlfriend at the time was just really, really angry and frustrated that she couldn't do anything to stimulate me orally. There was just nothing she could do that worked.
Oh man.
And I didn't tell her. I was like, this is just my norm. This is how it's always been for me. Like I don't know anything different. And she, being in Canada, like I'm told only 30% of Canadian males are cut, but I live in a province where we have the second highest of circumcision in Canada.
Okay.
So she had been with men that were intact, and she blurted out right off the bat. I said, I don't know what's wrong with me. She said, I know what the problem is.
Yeah.
You're circumcised.
Yeah. Wow.
I was like, I don't know what that means. So she's like, I'll Google it. Talk to me later.
Oh, that's a harsh way to get it, but yeah, it's nice that she was actually at least honest with you about it, because if I hear from women all the time that they don't say anything because they're afraid of hurting the guy's feelings. But I feel that we need to know, we need to learn, and otherwise, if we don't learn, if West men don't speak out about this, then this is going to keep on going, and it's clearly a harmful practice. It's always been intended to harm. So it blows me away sometimes when I come across people that have no idea about the history of it and how it was intended to harm. So many people, even myself, because it was happening so frequently and it was so common. When I was 35 years old, my first son came along. I thought that was like, it had to be a good thing. It's gotta be. I mean, they wouldn't be doing it if it wasn't a good thing. And certainly didn't even think about the idea of it possibly being illegal in any way. It's like, it must be like clipping fingernails and cutting hair. And this is an excuse I hear. I'm sure you've seen that one plenty of times, right? So yeah, it's very frustrating. So it sounds like in Canada they don't teach about it in sex ed, just like we don't in the United States.
I have a twin sister, so this is an interesting comparison. In sex ed in Canada, at least in small towns like where I'm from, they have nurse practitioners come in when we're 11 years old, so grade 5, and they split the boys up. They split the boys and girls up. We're put into 2 different classrooms, and the nurse practitioners teach us for a week about sex ed and everything related to that.
Yeah.
The boys, we were never taught a thing about circumcision whatsoever. All we were told is just wash our genitals, and then everything else that would be involved in sex ed. Circumcision never came up. Yeah. My twin sister, on the other hand, the nurse practitioners told the girls that they need to be wary of men who aren't circumcised, because circumcised men are more likely to have STIs, specifically HPV, and they will give the women HPV, which will lead to cervical cancer. So these 11-year-old girls were indoctrinated by these nurse practitioners right off the bat to support circumcision.
Yeah. And now we know, based on one report that came out of Canada recently, and a study that came out of Denmark also just in the past couple months, that the STI claim is totally debunked, right? I mean, it's
Yes.
like, yeah, it's that whole STI claim is done. The HPV stuff, they have a vaccine for that anyways as well, so that's that kind of throws that whole idea out the window. Yeah, so it's I when I look back at sex ed, I think, you know what, it really shouldn't be called sex ed. It should be called reproduction education, because they mostly focus on, you know, okay, the egg goes down the fallopian tube and it gets inseminated by the semen, and you know, that's it, you know. And then you end up having a baby later on. It's like really, you know, off the top stuff. There's nothing about the sensuality of it, nothing about relationships. And maybe they'll teach, you know, tell you, you know, wear a condom. Or, you know, or from what I hear, some sex eds, you know, teach you, you know, abstinence, which,
Yep.
yeah, I when I think of this as psychologically, it's like, you know, if you tell kids don't do something like that, they end up just doing it because now they're
Yeah.
even more interested in doing
Oh, absolutely.
it. It's kind of sad that I figured this out on my second son, and then with my first son, it's like teaching them to ride a bicycle. With the second son, I said, don't put your feet on the pedals, but don't try to pedal. Just keep your feet on the ground and push. You know what he did in just a couple minutes, right? He was pedaling and he was zooming around like there's nothing to riding a bicycle. All of a sudden, it's oh yeah. So, anyways, people are probably used to me going through a list of items to talk about the way that we're harmed, and I've already got 40 some interviews on my channel about that. And since I know that you've been very busy being an advocate lately, trying to educate people about the harm on things like TikTok and Twitter and Facebook, right? You know, I've seen you all over the place. And before I go too far here, we often hear, never heard a man complain, right?
Yeah.
But then when guys like you and I step up and say, I'm complaining, hello, we get gaslit, right?
Yeah.
It's like, why do you think men don't complain?
Yeah.
Because we might be embarrassed. We might have to deal with people like, you know, jerks like you that, you know, gaslight us when we try to explain why we're unhappy. Yeah, it's frustrating. And you could just, you know, I personally, I get depressed about this topic sometimes. I just get very infuriated and frustrated, and you know, I want to provide people information. When, you know, if you're a doctor, people go to you for information, and when you're a lawyer, people go to you for, you know, direction and stuff like that. We're genital autonomy advocates. We're educated about the topic of, you know, genital cutting rituals and the harms and all that, and we're trying to share information, and we're not appreciated for it. It's really a sad thing.
Yeah.
So you shared a chat with in the group a little bit ago, and I was thinking maybe we could go through that chat with this person that pissed you off, and
Yeah.
we talked about some of the
Yeah. Understatement of the century.
yeah.
It was deeper than that. I didn't sleep last night.
One of the things she said is, go get your broke dick fixed. It probably happened because you were born a bitch anyway.
Yeah.
Truly gaslighting, hey?
Yeah.
Yeah. Do what you want with your kids. Yeah. Always pisses me off when someone says that. It's like, okay, well, then you have to say the same thing to the anti-FGM campaigners, and the people that are trying to stop scarification practices or neck stretching practices or any kind of thing that's harmful to children. That's unneeded. So and of course they don't care how we feel about anything. Take care of my patients. Oh, this was the nurse, right?
Yeah. That Savannah was and then the other woman was a young mom that was a friend of hers.
Yeah. It still blows me away how many medical professionals don't understand uh, basic anatomy of the male prep use. I actually got into a TikTok live with a doctor. He was trying to talk about gastrointestinal stuff, but I said, I said, well, what's your thoughts about circumcision? He said, roll it off the top. That's all he said. It's like, then I asked him, well, do you know anything about the Sorrells study? He's like, never heard of the Sorrells study. So hopefully he's not a genital mutilator, but yeah. Um, what I've definitely learned is it doesn't matter that studies are done and the results of the studies are put out in medical journals and stuff like that. It doesn't mean that these medical professionals are going to read them.
Oh no, and I know that especially here in Canada, because Canada doesn't encourage routine circumcision like America does.
Yeah.
As 30% of Canadian males are circumcised, but I still run into nurses here that are adamantly supportive of infant circumcision, despite,
Yeah.
well, I, for a fact, they weren't taught in nursing school to support it. They weren't taught about it at all. Because I've met nurses myself that have never even thought about circumcision because it's not allowed in the hospitals they work in. It happens at private clinics, so nurses don't come across it. Not usually here, but they'll still support it.
Yeah. Yeah. It's really frustrating. And we just don't have enough money to, enough donations to the nonprofits to get this information out to these medical professionals. And even if we did, how would we get it in front of these people? I've even gone as far as going into some hospitals and calling hospitals and saying, hey, this is how I feel about it as a cut dad. I'm I'm not happy that I'm cut, first of all. I'm also not happy that medical professionals are providing information to people. Although you're getting handed a form that gives, signs off your liability or whatever, that oh yeah, it's just like any other surgery, they might die or whatever, if it even says that much. So um here's another one. Was it Cassidy? Was that another nurse?
She's the mother. Savannah's the nurse,
Oh, okay.
and
Cassidy's
yeah,
the
the other
mother.
woman is the young mom.
Yeah, go seek medical attention for your fucked up head,
Yeah.
not your dickhead. Could you just imagine if someone said that to say now I'm going blank on Hebo Wardier. Hebo Wardier. She's a well-known anti-FGM advocate, and she's spoken out publicly on videos, and she's on Twitter and all that. And she basically sticks her middle finger up at the culture that she came from. I think she came
Mhm.
from Somalia, right?
Yeah.
And it's like they've told her that if you were still here, we'd cut out your tongue, right? Like, screw
Yeah.
you, you know. Um, I have freedom now, and that includes freedom of speech, and I'm going to speak
Yeah.
out against this. And you know what? Us men here in the United States, we have freedom of speech, thankfully, and we should keep on speaking out to protect the next generation as much as we possibly can, and not just protect the next generation of that's being born tomorrow or whatever, but the parents. Me as a parent, I'm thankful. I'm very thankful for Intactivist. I'm thankful that Intactivist information got out there and shared around and got into a magazine and some other stuff. That was over 16 years ago, when the internet didn't have nearly as much information as it does now. So there's a lot more information out there. Unfortunately, if you just type in the word circumcision, the Intactivist information doesn't show up near the top. I think there's only two organizations that I saw the last time I looked, and it was Your Whole Baby and Doctors Opposing Circumcision. So unfortunately, you had to go down several pages to find the good information. It's pretty sad. It irritates me a little bit that people think of us as crazies.
Yeah.
For advocating against this and speaking out and being angry, but we're not. We're very. If someone came up to you and took a knife to your body right now without a medical need, it wasn't a surgeon that was trying to fix you, you'd be pissed. anyone would be pissed. Anyone would be rightfully angry and lash out and ask for justice.
Yeah.
Right. We would want someone thrown in jail for battery and assault. But no, it's because it's such a normalized thing. We're supposed to be thankful that erogenous tissue has been removed from our bodies. It's
Yeah, I'm not thankful for it. That's for sure.
Yeah. Yeah.
Right.
Yeah.
Like that was fighting with me on it. She said that she's never heard of any sensitivity loss from it. And then she started quoting well-known circumcision supporters studies, which of course were heavily biased and not factual.
Like Brian Moore stuff.
Yeah, exactly. And then she insisted that the following day she's going to go to work and ask the male doctors what they feel about circumcision. But I'm pretty confident how that's going to go. These male doctors were likely circumcised at birth and culturally conditioned into supporting it all through childhood into adulthood into medical school, because the alternative of not supporting what was done to them is too horrible and gruesome to come to terms with. Yep. Which is what us victims of circumcision have come to terms with.
Yeah, these doctors, they're probably the worst. I often say this cognitive dissonance actually has multiple layers to it in this case, particularly for medical male doctors, because they've got the cognitive dissonance over their own genitalia. They've got the cognitive dissonance from the medical training they got. They've got cognitive dissonance probably from cutting their own children. They've got cognitive dissonance probably even from their own religion. So it's you have to break down. You can't just break down one layer. You have to break down several layers when dealing with them. Let's see here. You're not a mother. You haven't even been faced with this. Maybe I should get back into that chat. It's like, well, I'm a father. How about that? Don't speak on shit. It's like, hello, you might end up with a son. One of your sons, or your son might end up like me, angry and upset. And I sometimes often respond to this stuff with like, well, just think of this as training for when your son gets old enough to study what I've studied, to find out how it works, what the anatomy and the functions of the male prepuce are, and they start asking you questions or challenging you on your decision.
Yep.
Circumcision, nothing more than a oh, that's a good one. Nothing more than a euphemism for genital mutilation, as not only is it disfiguring, it's also debilitating to the health and natural sexual functionality of the genitals. You look at some Brian Moore stuff, and he says, well, it's not. But sexual function. I think there's like one study out there that says it doesn't, stop sexual function. Well, it doesn't define in the study what sexual function is. Can you get an erection, and can you ejaculate? Okay, if that's all your sexual function is about, okay, yeah, maybe that's true. Yeah, I can still do that, but there's a whole lot more to sex than just those two things.
Yeah.
Right. I'm trying to get. I'm really hoping to get a sexologist on an interview sometime. I've been chatting with some. For the most part, the only sexologists I know are women. There's one sexologist that's the man. I've even been trying to get him to chat with me, but there's Lindsay Brooks on TikTok, LB sexologist, and she's talked about the topic per my request. So thank you to Lindsay Brooks for doing that. But I'd love to just get her into a conversation, a Zoom call like this to talk about it. As here, what else? Should we look at the, I don't know, the the um the bingo card
Yeah,
of excuses, or do you have any other excuses off the top of your head that you want to rant about?
I'll have to bring up the bingo card here and
I'm trying to see if I can bring it up here real quick myself. There it is. Bingo. Cites a specific medical benefit while ignoring the downside of surgical risk and loss of sensation. Yeah, so medical benefits. I always love this one. It's like, well, what else are we going to cut off our body to, reduce chances of some medical condition from getting us later on? And I always look at it as a mathematical thing. I've actually done a video on this. It's like, okay, so on one side of the equation, you have the value of the body part. And on the other side of the equation, you have the value of not having the body part. And you kind of need to see, okay, which one is has a higher value, right? It's like, okay, well, I think for a lot of people, and even myself, when I first started looking at this, like the value of the body part, well, as far as I know, that's 0. It's not worth anything, right? It's just some vestigial part. It's 0 to me because I never knew what it was. I was like, I never experienced it. It was removed from me when I was an infant. But as I've learned more, it's like, oh, actually, that part actually has lots of value. And the other side is the medical benefits values. Okay, it reduces chances of UTIs by a tiny, tiny amount. Still get UTIs. And you can always use antibiotics to treat those. So that doesn't give me any value. STIs, that's debunked. That was always heavily questioned in the first place because the studies from Africa was crummy. There's the penile cancer one.
oh,
Really?
that's the thing. Penile cancer. Like when I debate with women about the penile cancer thing, it's just, have you ever heard of any male having penile cancer at all? Ever? Does anybody know anybody who has penile cancer? Breast cancer is far more prevalent, but as far as I'm concerned, the equivalent of circumcision to prevent penile cancer is like cutting off your nipples to prevent breast cancer. Penile cancer can attack any part of the penis, not just the foreskin.
Yeah.
It's just foolish. Like I shouldn't tell medical personnel this.
Yeah. It's like a 1 in 1,000 lifetime chance of getting penile cancer, while you have a 1 in 8 chance of getting breast cancer. Yeah, that's just too low of a risk in the first place. Plus, pretty much the only ones that get penile cancer are people that are up there in age and they had troubles taking care of themselves down there. And I bet that a lot of that is just due to lack of care by nurses and stuff like that.
Oh, absolutely it is. I see lots of nurses that work in care homes that are adamantly supportive of circumcision because they're complaining about their patients and they get these crazy infections, and it's so sad to see these elderly gentlemen have to go get circumcised. Well, if these nurses are in charge of the hygienic care of these patients and their hygienic care fell so badly that they had to get body parts removed, that's neglect of the nurses.
Yeah.
That should not fall on the patients. Why would you preemptively remove a body part from an infant? Because it may possibly be a problem 90 years in the future because nurses neglected their job.
Yeah. Well, I'm going to have a little bit of empathy for the nurses. Most nurses, I've met some male nurses that take care of elderly people too, and they probably are a whole lot better at doing with this, particularly if they're intact male nurses. But female nurses, they're going to have to retract, right?
Yeah.
And chances are, I would imagine there's probably a very good chance that when they start trying to clean that, they're stroking it, and it's going to become erect, and they're going to feel weird.
Yeah.
I'm sorry, you signed up to be a nurse.
Yeah.
This is the reality of males, nurses. You got to do it. Sorry, but you got to do it. That's your job. So, it might feel like it's bordering on being a whore or whatever, but you got to do it. It's just the way it is.
I don't know how retracting a foreskin for a patient in a shower is any different than wiping their rear end. Like, they signed up for it. Nobody's making them do this.
Yeah. Yeah. Talking about that, I ran across one tweet one time from someone that worked at a daycare, and she was complaining because every time she went to change these intact boys' diapers, they would scream bloody murder because she was like pulling it down and pulling it back, and it's like she was forcefully retracting it. And I think she ended up deleting the tweet because she was really embarrassed. But she was called out and said, "Hey, you weren't supposed to be doing that." Yeah. So it just shows,
Even in Canada here, in my activism, I bring up the topic with nurses and daycare staff predominantly, because as far as the average person goes, they probably encounter circumcised or intact debate more than the average person.
Mm-hmm.
And even daycare staff here in Canada, where circumcision isn't encouraged and only 30% of us are circumcised, they say the same things that you are, that they have issues retracting these babies to clean them, and that they would choose to circumcise their own sons. And these are trained daycare staff. They go to college here. They get a degree in early childhood education, but no part of their training or education includes proper care of intact genitals.
Yeah. Yeah. And even the AAP has some instructions for daycare workers, because I called around to daycares in the area and they directed me to someone that teaches the daycares, and I got a hold of the person that is responsible for this, and it's like, well, we just go by the AAP thing, and she sent me the link to the AAP. It's like, there's nothing in there specific to the genitalia.
Yeah.
Nothing. It's got all this other stuff about clean this, be this way, be that way. I should bring it up again. I'm really tempted to start up a petition about getting them to fix that. But it doesn't matter whether it's male or female. They don't say how to wipe. With intact male, it's like you go to your old baby or other intact besides. It's like you wipe base to tip. Why can't they say that in the AAP statement in their documents? But yeah. Okay, so another bingo here. Bingo brings up the fact that women prefer cut guys. The fact. I guess there's been some studies done, but every time I've come across studies, it's like, okay, one study that shows that men prefer it cut is women that are in cut cultures. You can look at ones that are from none. It's like they prefer the other way around. So yeah, and it's still not a good enough excuse, right? Even if
it's very strange. Like, and Canada is like, Europe is obviously well known for most of Europe is obviously well known for not circumcising their children. America, on the other hand, is well known for like 90% are circumcised.
Oh, they were.
Canada falls somewhere in the middle. So we have women here that's where circumcision is very polarizing for them if they're quite sexually active. Yeah. They'll grow to appreciate intact men for all of the reasons that we know are to appreciate it. And then we have women that were culturally conditioned by their own family, or like my sisters, by nurse practitioners when they were 11 years old, to only favor circumcised men. But it's very strongly opinionated one way or the other. But the point, the way I see it is, it's just really rather foolish either way. Is these mothers are implementing their personal preference onto the body of their child.
Yeah.
And what does it matter? They're never going to be sexually active with their own child. Yeah. And just because they themselves or their friends or their family that are women prefer circumcised men, it isn't to say that the women that their son will be experiencing 20 years down the road are going to feel the same way as them.
Yeah.
It's nonsense.
for sure. And there's no reason why the individual, the baby that grows up to be a man, can't decide when he's a man.
Yes.
If he finds someone that really doesn't like him having foreskin, then he can choose to get part of it cut off. He can draw his own dotted lines. He can say, "Oh, I want to keep my inner mucosa. I want to keep my but just take a little bit of the outer layer off. Maybe pull it up a little bit and use a Mogan clamp versus doing the Placibel or Gomco clamp or something like that. That cuts off so much more. And stuff that that individual might want to have specific details. And a lot of people will respond, well, it's better, it's easier when they're a baby. It's like, no, it's not, because as a baby, first of all, as a baby, you can't put the baby under completely. So they're most likely going to be awake to some degree about it, unless they get they go out in shock, and they have to stick like a probe or something down to separate the inner mucosa from the glands, and that's that's painful and damaging and all that. Whereas a man, that's already broken down, so you should be retractable by that point in time, and don't have to do that step, so less painful, and you can be put completely under.
Could be totally put under, and a man can be administered pain relief, whereas a baby cannot. They just suffer for a week or 2 weeks or however long they take to recover.
Yep.
But it's okay. It must be okay, because they won't remember it.
Let's see here. I'm looking down at that and I noticed something is missing. Don't remember that one. Really irritates me too. It's like, if you woke up tomorrow and found out that one of your kidneys was removed from you long time ago, and you'd never even noticed a scar or anything, but your health hasn't been so great. Your health could have been better because if you would have had both of your kidneys, but you found out 20 years later someone took it out for no good reason. Would you be pissed? Probably. Even though missing that kidney probably doesn't hurt you a whole lot. I mean, missing out on erogenous tissue is a big deal. So, and erogenous tissue that has a lot of function. It's not just sensitive to touch, but it keeps the glands moist, and it leaves you with some flexibility. So things move up and down like it's supposed to.
It's not extra skin, like all these pro cutters like to proclaim it is.
That's what's the clitoral hood? Is that extra skin?
No,
it's not. Infant pain doesn't matter because he won't remember it. And here we've got Ronald Goldman's book. This book right here. So far, it's the only book I've seen where it's actually done actual research on that claim. There's lots of studies that he references, and you just see a whole bunch of references to actual studies about that claim, about how traumas early on in life affect us throughout life. So and some people have had nightmares, like Jay Jackson here, and myself, and a couple other people I've come across, where for me, I had a recurring nightmare all the way up into my 20s. And the same nightmare each time, and I was tied down, I didn't know that I was tied down, but I couldn't move. I just remember that I couldn't move. I felt like I was I don't know, paraplegic, and something was coming at me that I knew was going to hurt me, and I couldn't do anything to get out of the way or run or whatever. And every single time right before whatever would happen, I'd wake up right in a cold sweat, freaked out, right? So recurring nightmare. So
the deep-seated trauma that may be considered subconscious, Like I told you about the night I discovered circumcision, and my girlfriend at the time told me to Google it.
Yeah.
And the first thing that came up was a video of the procedure, coincidentally from 1997, the year of my birth, from Canada. And it was more or less a how-to step-by-step procedure of a baby getting circumcised with audio. And I watched it. I couldn't make myself look away. I watched the thing from start to end, and every step of the procedure, I swear I could feel it myself. Like, I obviously don't have those pieces of my body anymore, but I swear that when they stuck the forceps in and they just tore the foreskin away from the glands, I swore I could feel that.
Mm-hmm.
Like I legitimately felt like I could feel that pain on my own genitals.
Yeah.
It was just so disturbing.
I don't remember where it was, but I was watching something or listening to something. Someone was talking about the brain and how like if you could be an amputee, like missing your arm or hand or whatever, but the brain still registers as a being there.
Yeah.
Right?
Yeah. Ghost.
Yeah.
Yeah. So I watched this video, and by the end of it, I was reduced to a fetal position on the ground and just overwhelming anguish and tears for the rest of the night. I had more or less a complete mental breakdown. I was no longer a functioning member of society from having realized that my parents, my loving guardians, submitted me to this brutality.
Yeah. And for what?
And for what? And the brutal realization that it still goes on today is just, it was too much to handle. It shook the foundations of my world. Yeah. It affected just how I view society as a whole for allowing this violation to go on for so long. And here in Canada, we like to think that we're quite progressive and leaders in some way in terms of human rights. But this has been happening, and it still happens. Not to the same degree it happens in America, but it's still allowed.
Yeah.
If I had a child tomorrow, I could go tomorrow and get them circumcised because I felt like it, and that's not right.
Yeah. Yep. I even brought my kids, 15 and 16. I brought up to them one time. I think I recorded the video and it's on TikTok. I think I asked them, well, if I were to say we're going to go get you cut right now, what would you do? like hell no. Right? I mean, I don't know how some. Well, I do know. I some people will look at those videos of babies getting this done to them, and they're like, yeah, okay, the baby might be feeling pain, okay, but it's better for them. They're that convinced that they're better off.
Yeah.
And that it's worth going through. No pain, no gain kind of attitude, right?
Yeah.
So it's, and I hear you on it's very traumatizing to deal with this. Because not only did something happen to us, but we're not able to get any kind of justice for it. And not that we're not trying. What's that?
I have tried.
Yeah, you have tried?
I tried to get my complete medical records, and I will find the doctor that did. And I went to the SHA, the Saskatchewan Health Authority. On record, I was never circumcised. It didn't happen, according to them. And that's when I learned that they don't keep record of it because must be deemed so insignificant in their eyes that it's not tracked.
You follow Anthony Blood?
Heard of him. Okay,
so he's really popular on TikTok with talking about this. He talks about foreskin, right, restoration, stuff like that a lot. He's talked a little bit about the fact that things have changed over time because when he was cut, it wasn't even considered a surgery, so it doesn't show up in medical records in certain ways. And remind me, there's actually a man up in further east of you in Canada who's actually taking legal action, and I've been working with him, and he's also been working with some lawyers and stuff like that. and CHHRP. I don't know if you've heard of CHH. They're Canadian. It's often referred to as CHIRP. But yeah, there's things have changed about that, and I hope that they continue to change and evolve for the better, so that people see it as, yes, it is a surgery, because you are taking a knife, you're taking a sharp instrument, whether you're taking a placebel with a string or whatever, you're taking a sharp instrument to the body and
But
removing part of it.
as far as records being kept, I do know that there is must be a great deal of corrupt aspect to it, because I have a nephew who unfortunately was circumcised after I was unable to convince my sister not to do it.
Man, I'm so sorry.
That was a horrible thing for me to discover.
Yeah, that's harsh.
I questioned my sister and brother-in-law about this to the nth degree. They were required to pay in cash bills for the procedure at a private clinic. They couldn't pay with a card, and I couldn't figure out why. And I have a friend who is a medical, she's a medical assistant that does administration at one of these clinics. And she says, yeah, I can tell you with a pretty good guess why we'd have to ask for cash. So there's no paper trail, because they don't keep records of it. According to this medical assistant, when they perform a circumcision at the clinic, a record is not kept. So what I got out of this is, if a parent consents, signs the form, that gets the doctors off the hook for any sort of repercussion. And because there's no paper trail from a card or cash, the child later on down the road can't go back and look through banking information and find out, well, I was cut at this clinic. There's no proof. That's corrupt. That must be corrupt. They're covering their own backs.
Yeah. If it was me, I'd call the freaking Child Protective Services. If I was in your shoes. I have done that before. I've called Child Protective Services on multiple cases where I knew where a child was going to get cut and what town. So I would refer to Child Protective Services to a Facebook page or whatever, saying, well, this person is going to have this done. I ran into one CPS person, which was a woman that was a mother, and I cut her. And she tried to, she's like, that's circumcision. Like, it's prepuce amputation, woman.
And I couldn't have called on behalf of my nephew, because the same time that I discovered circumcision, my sister was about 3 months pregnant, and she was not interested in ever finding out the sex of the baby. So it became very clear to me that I can't go back in time and save myself from being circumcised, but maybe I will find peace and save my potentially unborn nephew and every other member of my family from this procedure. So I spent the next 6 months sending every peer-reviewed article, study, documentary to my sister and my brother-in-law, begging them to learn about this, to not do it if they had a child that was a male. And they never told me one way or the other if they were agreeing or disagreeing with me. They were acknowledging that I was sending it to them, and that's it. And then my nephew was born, and that was lovely. And I became his godfather, so I see him quite a lot. And 4 days after he was born, my sister invited me over, and she was making lunch, and she asked me to change him. And I changed him. And when I opened his diaper, there was blood. And I saw right off the bat, like, this is how I discovered my nephew was mutilated after I spent 6 months trying to save him from this. And he was very fussy, as people would like to say. And then I figured out why. And I just exploded. Like, she said I was being a crazy person. And I says, hear me now. For doing this to your child, by the time he is old enough to understand what sex is, I will personally tell him what you did. And he'll hate you for it, and you'll deserve it. And she says, no, you won't tell my child that. This is, Why are you scared it's true? I was like, I'm
You're
going to
probably
tell
gonna
him.
find out anyways. And people don't understand this information is easy to find these days. Finding out what the anatomy and functions of the male prepuce or the foreskin are and the history behind the whole practice is very, 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 very easy these days.
Yeah, my
So
poor nephew figure it out, and for her to have the audacity, that's how I was to discover that she didn't listen to me and circumcised him, had me changing the day after he was cut. I broke the door off her house in a blind fit of rage.
man,
Like, oh, like I'm not a violent person, but
yeah.
that so deeply angered me that had my sister been a brother instead and did that, I probably would have beat him into the ground. I I just couldn't handle that degree of brutality and betrayal. I still can't. It permanently damaged the relationship with my sister.
I hear you, man. That's harsh. So what? Again, so like, I don't know if you can see that Medical Board of California.
Yeah.
I've tried to report things to authorities, whether they're going to take me seriously or not. At least they can't say that I didn't try. But I don't know. I think there's a little bit of a different system up there in Canada. But report if you know the clinic that he was cut at, and the fact that they took requested cash and stuff like that. Report that to whatever authority, because that might be a no to not be documenting it and all that stuff.
I wasn't told what clinic he was cut at,
Okay.
and I know why, because my sister wouldn't have wanted me to know that information if she knows that I'm going to tell him that she circumcised him after I told her not to.
Yeah, chances are it's pediatrician, but yeah, I'm sorry to deal with that. They have to deal with that. It's brutal. I mean, it's brutal to you.
My nephew turned 3 in May, and every time I look at him, I just feel overwhelming guilt that I failed to save him.
Yeah,
my first chance, that was my first attempt at being an intactivist before I knew what intactivism was.
Yeah,
was going to save my nephew, and that would bring me peace. And I failed to save him, and then I definitely didn't find peace.
I'd really like to hear from her and the father. Did they even look at the studies that you sent them, the papers, and what convinced them to still do it anyways? I've done some of this stuff with my own family members and presented my stuff, my side of it, my opinion, my information and everything like that. You would think that having boys of my own that I'd be taken seriously and I'd be thought of as some sort of an expert on this, but they didn't give me any kind of feedback, give me confirmation one way or another, and that's really frustrating. It's like, well, what do you think? What do you think? I gave you this information. What do you think?
Well, they claim that they read all of the studies that I sent them, and then my sister says that her friends that are nurses told me that the studies I sent to her were bullshit, essentially. And these nurses have sons, and they circumcise their sons. So out of their own personal views, wherever they got them from, they cut their sons. And when my sister asked about it, because my sister considered these nurses a higher authority than I am on the subject, despite my personal experience and my diagnosis that she knew about, she disregarded me and listened to the nurses. And then having talked about it with her further, the other side of it was she desperately wanted my nephew's genitals to match his father's.
Well, hopefully the nephew didn't get botched.
That's what I said. So if my nephew was botched, was my brother-in-law going to go and get botched too? Because he's got to match him, right?
Yeah. I can understand matching clothing, but matching body parts, that's just ridiculous.
Yeah, I've had a fight with my own father about this because he submitted me to circumcision so I would match him. And the night I discovered I was circumcised, I called him. I says, "Am I circumcised?" He says, "Yes, you are." I says, "Why?" He says, "Well, I thought it important you match me." And my immediate response was, I'm like, "Why? What do you think we're going to do? Sit around at Thanksgiving and compare dicks? Like, why do I need to match you? Like, your wrist was cut by glass as a kid. Were you going to cut mine to match it? And you've got screws in your ankles. Were you going to put screws in mine? Your appendix was taken. Were you going to take mine?" Like,
Exactly.
where did it end?
Man.
But I never had a matching haircut to him though. That never happened. Just a matching penis.
Yeah. Yeah. Ugh. I'm sorry, man. I hope things turn a little bit for you and people. I hope things will turn for all of us and people will appreciate us more. I have had some people come to me that fought me at first, then say, you know what, you're right. Keep doing what you're doing. So that always feels good. It just it doesn't happen often enough.
I have a very personal current relation to that.
Oh, yeah.
The woman that I'm seeing these days, she is a nurse. And when I first met her, it was on a dating app. And I learned a long time ago that it's a core value of mine that if I'm going to see a woman, she can't support circumcision.
Mhm.
So I asked fairly early on in the conversation, what if they have any thoughts of it, if any. And at the time, she was adamantly supportive of
Really?
circumcision. We fought full out screaming match for like 4 hours.
Seriously?
I hated her with every fiber of my being. Just, oh, I hated her.
And you're still dating her?
So it gets interesting. So we were just vicious with each other. Like I don't even know. I couldn't even give an example. It was just really, really bad.
Uh-huh.
So unmatched each other, found each other on Facebook, blocked each other, just hate you, just with every fiber of my being. I can't hate you more than possible.
Mhm.
And then 3 weeks later, she had a near-death incident, and she became a patient in the hospital, and she experienced medical malpractice. The doctors thought she had appendicitis, and they took her appendix and caused further internal damage. They screwed up they botched the procedure, and she almost died from septic shock. So then her faith in healthcare was shaken because she previously supported circumcision because she witnessed some in clinicals in nursing school. Well, it's part of healthcare. It must be right. But after she learned that healthcare isn't perfect from almost dying, she managed to figure out my Snapchat username, added me on Snapchat 3 weeks later after this fight, begged for forgiveness.
Seriously?
Told me she did further research, learned how wrong she was, and that she would like to go on a date and have a second chance.
Awesome.
I was so floored. I was like, "This is a joke. You're baiting me. This is something's bad gonna come from this. I know it." She goes, "No, I mean it. This is I mean it with every fiber of my being. I'm just so sorry." I was like, "Well, I guess maybe this could be entertaining. I'll give it a crack." And I'm seeing her. Imagine that.
How long have you been seeing her since?
About a month and a half now.
That's an amazing story, man. That's awesome. That makes this video so awesome. That's great.
It's only happened once where I fought somebody to that degree, and they went out to contact me to say that they were wrong.
That's sweet. That is just so sweet. That's awesome. Good job, man. That's sweet. Hopefully she'll join the child rights nurses people or nurses for the rights of the child.
I keep poking her till I was like, "Become an activist. Share your story."
Yeah,
like, you could matter here.
Yeah, she's probably scared shitless though, because she'd probably be worried about losing her job for speaking out.
Yeah.
But I don't know if you ever come across TikTok videos. There's some medical professionals that are just saying, fuck this. This is our medical system needs to be fixed, and they're like, fix it. I don't care if I saw one person that like just left their job to be able to do a documentary on how our medical system is screwed up in the United States. So who knows? Hopefully they talk about how it's screwed up with circumcision too.
Yeah.
Man. Well, remind me to connect you to the guy that's trying to sue there in Canada, because you might find that
Yeah,
interesting.
I would like to hear more about that, because I desperately want to find out who did this to me, and I would do the same.
Yeah, it's really concerning that they're burying the evidence about this in order to avoid getting lawsuits. But the upside to that is that means that they know that the baby might come back after them later on. So maybe that hopefully is deterring some people from doing it. So,
Yeah.
yeah. I don't know if you know, but I protested with Bloodstained Men up in Vancouver at the Pollock Clinic and at the library there in Vancouver.
Oh, he has a clinic in my city as well. They advertise on the radio. They advertise buses, on billboards.
The Pollock method.
Yeah, gentle procedures.
Yeah, whatever.
Yeah, exactly.
It's not so gentle.
Genital mutilation.
Yeah, you can't make removing a valuable body part gentle unless you're doing it with a medical need. I'm sorry. I don't care if you completely take away the pain. You've removed a valuable body part. So.
Yep.
Another one labels all intactivists as hysterical and proceeds to ignore all rational arguments against infant circumcision. That's kind of funny, right? It's like you're labeling us hysterical, but you're ignoring all rational arguments. I avoid using word infant because it's wrong. I don't care if it's 2, 3, 4, 5, 8 years old or whatever. Until that person is old enough to consent, it should be done. And yeah, infant circumcision is the main thing that happens in the United States. But you go to places like South Korea and other places, it's done to boys at older ages. So that's wrong too. Trivializes the surgery as a minor procedure that removes a tiny bit of excess skin. Tiny bit of excess skin. Here, oh, here's my measuring tape here. Here, okay. Well, if we know that it's going to cut like right down here, and we put the ruler there. Let's see. We'll bring it down. Keep my finger there. Right. So it's that much skin, and that's like over 3 inches long, right? And we know that's like 5 inches around. So that's like the size of my phone, right?
It's much like that nurse that I fought with last night that just drove me wild. It's a tiny bit of skin. Why do you care so much? Or she said something along those lines. It's like, that's interesting. It's like, your clitoral hood is even smaller, so it must be just absolutely insignificant. So why would you care if somebody took it from you? And a clitoris is even smaller yet. It must be totally insignificant. You shouldn't miss it if it's gone.
Hopefully this doesn't weird you out or anything, but I bet she finds you attractive now because you maintained your integrity, you stood your ground, and you're passionate about the topic.
The last baby that I saved from a mother that booked a circumcision 2 days later, I could send you the screenshots of the conversation if you like. After having fought with her for 3 hours, I managed to turn her around, and that's only happened a couple times. And after she changed her mind, she asked me about intact care and all that, and then she proceeded to hit on me. Really quite heavily. Like to quote, "You're crazy, like real crazy, but you're the cute kind of crazy." That's just like, I'm flattered, but you just spent an hour explaining to me how you think uncircumcised, which is a silly word, intact.
Yeah.
Intact penises are ugly, weird, and gross. It's like, it's nice that you're not going to mutilate your son now. That's great. But I still don't want anything to do with a woman that body shames men to that degree. Yeah. That for not being mutilated, they're gross, weird, and ugly. It's like, have a good day. Thank you for not mutilating your son. This was a fun chat.
Yeah. Oh, well, still fun.
and the nurse being, after having fought her and she came back and apologized, she told me she had immense respect for me And she said she likes a man that can put her in her place and stand up to her.
Yeah, I was right.
Yeah.
Someone that has integrity, has passion, that stands his ground.
Yeah.
Yeah.
You like that.
Yeah. Yeah. And that kind of gets to me about the, people sometimes, call us chumps or whatever. I kind of stretching for words here right now, but calls us names like wimps or whatever for complaining about our lost foreskins.
Weirdos, pedophiles, pussy.
Oh yeah, that one. Yeah, pussies. That's a good one. Or snowflake. It's like, you know what? Us men that are fighting to protect protect children from genital cutting, we are the toughest, most badass people there are on this freaking planet. Because we're facing people that they give us such a hard freaking time.
Yeah.
I mean, we might not be wearing, battle armor and swords, but we're dealing with a social issue, one that's very, very difficult and very, very challenging for our mental health.
After my fight last night with that nurse and that mother, I don't know if I've been that angry before, and that includes when I discovered my nephew's own circumcision. I just determined that I had to give up on activism, because it was going to make me into the psychopath that these women say I am.
Yeah.
Like I'm telling you, I've diagnosed issues, legitimate diagnosed issues, from having seen several specialists for 4 years in Canada. And they say I'm full of shit. My diagnosis is BS. I'm making it up. I'm just a pussy. I need to get over it. And then proceed to make fun of me for having a broken dick. And antagonize me further by saying like have a good night. I can't wait to wake up tomorrow and assist with more circumcisions. So, like, insult to injury. And I'm a freaking victim of this. What would they tell women that were circumcised in America before 96? And tell them get over it.
Mm-hmm. Yeah, well, some do. Here, do I have her book up there? There's a book from, I'm going blank on her name right now, but she wrote a book. She's a victim of female genital mutilation from the United States. Gosh, I'm going blank on her name right now, but she when she was really little, and she didn't remember the procedure, but when she was really little, they cut out part of her clitoris. Yeah. And things didn't feel right there, and she went to someone, and he the story is really crazy. Gosh, I need to find the freaking book again. I brought it up before. And I've actually chatted with her. I actually got her to join us on the Bodyguards, which is an international coalition. It was originally called ICASM, International Coalition for the Abandonment of Sexual Mutilation. Dang it, going blank on her name. But anyways, I read the book. It's really interesting. Again, female circumcision was, a thing in the United States. It was allowed on children. Now it's, this kind of stuff is only allowed on consenting adult women. Not that it's not happening. We know about the Dawoodi Bora tribe and stuff like that. That kind of stuff is going on. But yeah, she basically got gaslit by a doctor too, and she went and looked. She got all the tools and everything, and looked at herself under kind of like a microscope sort of thing, and saw the crosshatch where she was cut open. So yeah. Anyways.
And reminds me, speaking of female circumcision, the nurse that I fought with, she said, well, she didn't necessarily, she claimed she didn't necessarily support circumcision. She just said it's her job. But then she followed it up with saying that one day she's going to have circumcised sons in her house. But she followed it up with again, when I rebutted with, what would you do if you were a nurse before 96 in America? Would you circumcise girls because you're asked to do it?
Mhm.
And she said, well, it's my duty as a healthcare provider to do as the parents ask,
Yeah.
because it's their right to consent to their child's procedures.
Yep.
Like, okay, so you are void of
Oh yeah.
compassion, understanding, or even a concept of right and wrong.
Yeah. Yeah. Some people, you bring up the whole female circumcision thing, and they're supportive of that too. It's
Yeah,
really
that,
freaky.
that was baffling. That an intact woman could say, yeah, I could take the clitoris from a girl because the parents asked me to.
Oh my gosh.
Like, oh,
Yeah.
but it's fine because the parents signed consent forms, and it's my duty as a healthcare provider. But the
That's
term
not healthcare.
no, it's not healthcare, and the term duty brings a striking resemblance to the excuses given by war criminals when they perform a violation
Nazis.
upon humanity, and they say, "Oh, I was under orders.
Yeah.
I was
Doing my
under
job.
orders. It was my duty."
Yep. Yeah. What about the Hippocratic Oath again?
Yeah.
You did sign up on that, right?
Yeah.
So yeah, conflict. Anyways. It's a several thousand-year-old tradition. Why stop now? Slavery lasted for a long time too. Hello. And the foot binding. Luckily that stopped, but it lasted for how many years?
Yeah.
I have no idea how long, but I know one guy, Kyle Chin, he would be able to tell me. Attacks genital integrity advocacy as an expression of homosexuality and/or foreskin fetishism. You know what? Call me a foreskin fetishist. I don't care. I don't have one. So yeah, I'm all right with the idea of being called a foreskin fetishist. I wish I had it. Thank you very much.
I fought with a woman last night that said, after I was making my point defend against circumcision, she said, "Well, you're either gay or a misogynist." So it's like, okay, so what if I was gay? What if I was gay? Are you homophobic?
Exactly.
It's like, what if I was gay? What point are you trying to make?
Yeah, I bring that up a lot with Jim Jeffries. I don't know if you saw that episode of Jim Jeffries where he did the act on the stage about doing docking. It's something that gay intact guys do together, and he was making fun of it, right? I'm making fun of gay intact guys, and he went on to talk about how he got his son cut because he loved him. Like, how homophobic can you be? You're basically, in a way, forcing your child to not be homosexual.
Yeah, taking a pleasure away that can be enjoyed by homosexual people.
Yeah. So yeah, some people are proud to be anti-pride, anti-homosexual, anti-LGBTQ, whatever. What are you gonna do with those people? Can't really do a whole lot other than just say, well, yeah, okay, I've looked at a lot of dicks in my life. 51 years old, and I've been analyzing a lot of dicks, especially since I became a dad. It's like I've been looking at a lot of dicks to try to understand what the differences are between the intact and the not intact. And when you look long enough, it's as easy as seeing someone that's missing a hand. It's like, yeah, there's a difference. There's a clear difference. A person that only has one hand versus someone that has two hands. A person that has a prepuce and a person that does not. There are clear differences. So you just have to be willing to look. And yeah, a lot of guys are going to be too weirded out, I guess, to look at it or to really analyze and understand it. So selectively dismisses any contrary opinion when expressed by a woman by claiming that not having a penis invalidates her point of view. Do women not have sex with men? So yeah, they should be able to have a point of view. They certainly have a point of view if they're having sex.
And I'm a firm believer that every person in society should have a strong opinion on this, because there's unfortunately a large number of women that give birth with an absent father, so they have to make the decisions on behalf of their child without the father around. So
Yeah.
they're gonna have to have an opinion on circumcision if it's offered to them.
Yeah.
But no, which only the father should have an opinion. Just, well, no, if the father's not around, the mother has to have an opinion.
Mhm. Yeah. They I often see this statement. I only see women complaining about this. I don't see men, like, why aren't men talking about it? It's like, well, look at Heba Wardia, for example. I watched 3 of her videos talking about this topic, and in a couple of those, she explained how it's very traumatic to go through the story of what happened to her when she was a little girl, and getting out of Somalia and all that stuff. And it's like she has to go. She's living through it again emotionally every time she has to talk about it. And it's same for us when we have to talk about it, especially when we're dealing with people that have deep cognitive dissonance over it. It's very traumatizing for us to talk about it. So in a way, we need the women to talk to defend us. It's kind of sad, but that's reality.
They're as far as I'm concerned, in many ways, they're tougher than us in their defense of it, because they're not victims themselves.
Yeah.
They're more or less standing up for us.
Yeah.
And in my own debates with women locally, when if I find a woman that I have romantic interest in, and I'm trying to find out if her views on this, to know if she's compatible, and the women that fight me on it, which is lots, unfortunately, they say, well, I've never heard a man other than you complain. It's just, I was 20 years old before I found out I was circumcised, and I had issues my entire life, and I didn't know it because it was the norm.
Yep, and I was 35.
Go any other way. I had issues that were diagnosed at 20 years old and didn't know they were issues.
Yep.
How many other men are going to be up there like me that have issues and don't know it because it's their norm?
There's tons.
And those men that have issues say they know it. No man wants to admit that he has problems with his penis, his pride and joy. No man wants to admit that, especially to a woman. It's just not going to happen. His pride will not allow him to do that.
Yeah, and what's really interesting too, you can look at some numbers. You look at the numbers of people that are in activist groups that where people are actively trying to advocate for genital autonomy, and then you go look at groups like Foreskin Restoration and like on Reddit. There's 20,000 men on Reddit talking about restoring their foreskin, but you only find small numbers like 3,000 or 4,000, 5,000 people altogether, male and female, trying to defend genital autonomy. That's how many. That's how large. That gives you a kind of a percentage-wise saying, you probably figure 9 out of 10 men will not speak up about this because they're too afraid to. So for every one man that you find complaining, there's at least 9 more out there. And I know this from dealing with men in person, that like, yeah, I don't like the fact I'm cut or whatever. And I know that this comes up too when like busting men and cockfight, they're out protesting and everything like that. And men will like, yeah, I agree with you. But I'm not going to say anything, or I'm going to stay out of the limelight or whatever.
And I've discussed this with my own male friends, and unfortunately, all of my male friends, to my knowledge, except one, are circumcised, which is kind of unusual in the grand scheme of things for the statistics that Canada has. But anyway, most of them have never thought about it in any way, shape, or form. They don't know anything about it, and they don't want to.
Yeah,
they don't want to know the truth behind it, because they see me and they see how I felt about it for the last 4 years, and they don't want to feel what I feel. They don't want to be a part of it. They are choosing to ignorance. So
because it's bliss.
The truth doesn't consume them.
Ignorance is bliss. And
yes, exactly.
Honestly, I really wish a lot of times that I was still ignorant about it. I don't want to think about that when I'm in bed. I don't want to think about what I'm missing.
Yeah, I every day, like my parents still support circumcision, and they tell me, "Oh, why can't you just get over it? It happened 24 years ago." See, Well, it's not like if you lost, say, a loved one and you grieve the loss of a loved one, but every day gets a little bit easier because you don't see them anymore. Every day I wake up, I'm reminded that a part of my body is taken. Every time I go to the bathroom, I'm reminded. Every single day I get a fresh reminder that part of my body is missing. Every time I sleep with my girlfriend, I'm reminded. It is not going to go away.
Yeah. Yep. Man, I am right there with you. Totally agree with you. And I also wake up thinking, there's another 10,000 some children getting cut today.
Yep.
In the world. 3,000 of them are in the United States alone.
Yeah, we see posts about it on Facebook all the time. Mm-hmm. And locally, the one of the clinics that's quite well known for performing circumcisions, they're called Lakeside Medical Clinic. They advertise on Facebook that they book all the circumcisions on Tuesdays. So they line them up like an assembly line. And I spoke to a medical assistant there who I sneakily befriended to find out some information on the clinic. Mm-hmm. And she assists in the circumcisions. And they say there's a very few doctors in Saskatchewan or Canada that are willing to perform the procedure. Realistically, very few. So that doctor travels the province going from clinic to clinic on days with high rates of circumcisions, and that's what they do. So the doctor that goes to Lakeside Medical Clinic, her name is Diana Naidu, and Diana has all the babies lined up, and she works with a medical assistant that is actually a medical student at the University of Saskatchewan. And as a summer job, this medical student assists in circumcisions. That's it. And she said they just line them up and they just do one after the other the whole day on Tuesday. So then I look at my calendar every week and I go, oh, it's Tuesday. Right now, not more than 5 minutes from my house. Yeah. Our baby's suffering.
Yeah. Yep. Yeah. I hear you, man. Yeah. There's some clinics around here in the LA area too. I just want to get up every single day and go stand in front of it with my black-thing pants from Brother K and protest.
Yeah.
I only have so much time.
And I live in the biggest city in my province. There's only about 250,000 people here, mm-hmm. in a province the size of Texas. So we're pretty sparsely populated.
Yeah, I've been up there.
Yeah, so I could go and protest, but I would be alone. I would be alone, and the risk of being verbally or physically attacked is probably quite high.
Oh, high. Well, we'll find someone else up there at some point with you to join you or something. I feel a little bit. I feel fairly safe here on the West Coast, going out and protesting by myself. I haven't really had any violent attacks or anything on me. I've had some people, tell me names or stick, middle fingers up at me, but
yeah, that's not here nor there.
Yeah, or I had one Jewish guy yell at me. It's like, no, it doesn't harm. There's studies for it. It's like, you're probably thinking of the Basio study, and if you actually read the whole thing, you see, yeah, it does harm. Anyways, it's the one again. It's easier to do in infancy rather than when he grows up. And I've already covered that, right? Becomes indignant and refuses to acknowledge any similarity between non-consensual circumcision and female genital cutting. Yeah, we get that all the time, right? It's not the same. Yeah,
it's not the same. Women can't enjoy sex after they're mutilated, and men can.
Yeah.
Well, there's several different kinds of female mutilation, and there's a large percentage of women that were mutilated in the world that think it's necessary, and they would cut their own daughters. Oh, but it's not the same.
Here, non-consensual, non-therapeutic. Non-consensual, non-therapeutic. Those aren't the same. And it's genitalia, and is genitalia. Okay, yeah, it might be different shapes and sizes, but it's still cutting genitalia. Still cutting off parts of someone's body without a medical need. So when you're talking about ethics, it's the same thing. Look up Dr. Brian Earp, EARP, if anyone wants to know. complains about any proposed legislation to protect genital integrity as governmental intrusion. It's sexual battery of a minor, so they don't need to do any legislation. It's already against the law, just not being enforced. And hopefully the circumcision is a fraud lawsuit will make some headway soon.
That would be a bonus.
Yeah. I don't know if you know, but I took a case to federal court myself.
Oh, I did not know that.
Yeah, I started out by filing a complaint with the sheriff's office of where I was born, the county that I was born. But I was born in the Navy hospital, so they passed it to the Navy place, which of course I never heard anything from them. But at least I got a case number, and at least I know some eyes from the police department saw it, so they at least now know. Yeah, there are some men that complain. How about that? And see it as just that, sexual battery of a minor. And then I filed a tort claim against the Navy, and that was dismissed because it was past the 2-year statute of limitations. It's like, well, it's the statute of limitations only applies if it is a medical procedure. How is it a medical procedure? It's not a medical procedure because there's no medical indication. so it's like, well, you go take it to federal court if you want. Like, okay, we'll do. And that's what I did. But I might have done it wrong, whatever. I did it myself. I didn't have a lawyer involved, but I wasn't going to find a lawyer that was going to take the case, but without having, $200,000 or something to throw at them. But what it came down to is a Federal Tort Claims Act. You might like your country better after knowing this. The Federal Tort Claims Act prevents people from suing the federal government for things like assault. How about that? So we have these rights that are in our Constitution, but we can't do anything about it if our government actually breaks those rights. How about that? How does this FTCA thing line up with the U.S. Constitution? I don't get it. Like, my body integrity was violated. My religious freedom was violated, and I'm living with that. And I can't do anything about it. I can't get any kind of justice.
I couldn't say if Canada has similar laws to that.
No.
I don't know.
Yeah. In Canada, I don't think I'm pretty sure the Canadian military doesn't perform these procedures in their military hospitals, right?
No.
And Canadian medical insurance doesn't pay for it, right? So yeah, I don't think your government is in any way involved with this practice at all.
No.
Whereas here in the United States, our federal government is, because they're doing it in military hospitals, and like 40 of our states are involved because they're paying for the practice through Medicaid.
Yeah, like in Canada, it's not a secret. It's like we like to brag about it, that we have this lovely free healthcare, but free healthcare does not include circumcision. Yeah. The SJ outright says, if you look up like circumcision in Saskatchewan, that the benefits are negligible and it is largely considered a cosmetic procedure. Therefore, public hospitals don't offer it. Like, to my knowledge, there's only one hospital in my city that offers it, and it's strictly because the chief of the hospital is a Jewish man, and he made a big stink about it in the news, saying it was a violation of his religious freedoms. Every other public hospital that I know of in Saskatchewan had to quit offering this in 2008. It was in the news.
Oh.
So now only private clinics can offer it because our government wasn't willing to totally ban it. Mm-hmm. But they made it so the public hospitals can't do it because it wasn't considered medically necessary. So they don't want to back up the hospitals with unnecessary cosmetic procedures.
Yeah.
So now it's just a paid in cash thing at private clinics.
So it's not recorded anywhere, unfortunately. So you can't sue later on in life.
Correct.
So I mean, there's pros and cons. That's the part that worries me about making it banned or illegal or whatever. It's just, it might just force it to go under the radar and still happening, and maybe happen in worse ways. So, what to do? To me, it's more about educating people about the harm and everything. And if we could just get everyone educated, then it'll just stop anyways. I think we shouldn't have to worry about banning it. So I don't think. I think if people were educated enough about it, there wouldn't be the drive to do it. Like if you were to compare it to like abortions, last time abortions were made illegal, that happened, behind closed doors and illegally, and it made things worse in a lot of ways. So
I've talked to them. I befriended a couple sexual health nurses here, here in Saskatoon, and they work at the local sexual health clinic. And both of them are adamantly against circumcision because they have men coming in and complaining like myself about it.
Oh,
yes.
Awesome.
Yes, they know the damage. They're educated on it. They want to see it banned. And these two nurses, they're of the belief from their superiors, just from their conversation with their superiors, that the reason that infant circumcision, has not yet been banned in Canada is that we have very strong lobbying from religious groups.
Yep.
Yeah. Yeah.
I actually wrote an article on my blog about this. In the United States during the Obama administration, a law was passed. It was kind of bundled up into a whole bunch of other laws, but you could find in it specific information about male circumcision. And this whole law is about relationships between the United States and other countries. So it's basically saying that that the U.S. doesn't think that it's okay for other countries to persecute people that at least talk about circumcision, male circumcision, or whatever, or push male circumcision. So I really think that has a lot to do with the fact that Denmark and Iceland did not successfully ban it, even though 90% of their population were totally supportive of banning it. So I would imagine that that's probably another reason why Canada isn't going as far as totally banning it, and they're blocking it as in every way that they can legally, right, by not having it in their hospital and stuff like that.
They're just unfortunately doing a very poor job of educating the public on it.
Yeah.
Only who want to find the information will find it.
Mm-hmm. Yeah, and you have to search for the right things. You can't just type in circumcision because, like I said earlier, you got to go through several pages to find good information. Frustrating. Oh, more important issues or concerns to worry about. I think your whole baby put together a whole chart of issues or concerns that this issue actually covers. So, and what? Okay, whatever. If you have bigger issues to go fight, then go fight them instead of fighting with me while I try to educate people about genital autonomy. It's like, why even bothering with, telling me that? Just go your merry way.
And like that nurse and that mother last night, they told me that, there's bigger issues. It's like, okay, but like, I'm an activist for this. I'm an activist for other things too. I'll go fight them after I'm done fighting you.
Yeah. Yeah. I still wonder why people say that. Why do they even take the time to write to you and say, hey, there are bigger issues? Why tell me that? What purpose is it serving you to tell me that there are bigger issues? Is it just an ad hominem attack on me, or are you just trying to shoo me away?
I think they're running out of rebuttals.
Yeah.
Rebuttals and retaliation. They resort to measly name calling, like that nurse. Her professionalism just slowly started decreasing throughout the night, and by the end of it, you're a pussy with a broken dick.
Yeah.
You're just real mad, and you ran out of good points. Like I'm sorry that that you're just that mad that all you can come up with is you're a pussy.
Mm-hmm. It really blows me away that people even say you're a pussy. I mean, it's like, do you know what pussies put up with? I mean, those things are pretty amazing. Okay, go ahead, call me a pussy. Oh, that's great. Yeah.
Her friend who was fighting with just said, well, you can't say anything because I pushed this 9-pound baby out of my vagina and it's my baby, so it's my choice. I'm like, okay, so because your child ripped your vagina, you feel entitled to rip parts of his gender.
Oh my gosh, yeah, that one. Oh.
Like, you're taking revenge on your child?
Yeah.
Like, nobody made you have a baby.
Or the people that'll say, well, just because of you, because you're pissing me off, I'm going to get my kid cut. Just because of you, I'm going to blame it on you. Yeah. What? Wow. Be sure to show your kid this in 18 years or 15 years, something like that.
When your son comes and asks you, Mom, why was I circumcised? Well, because some men on the internet made me mad. And I had to show them by cutting you because I was mad.
Yeah.
And I really showed them.
Yeah. Digs up a story of someone who needed a circumcision later in life because of a freak accident or rare illness. Yeah. I sometimes run into people that are like, well, I've had to deal with all these intact men at this nursing center or whatever as a nurse, and so many of them had problems. Okay. Does that mean that most men have these problems? I mean, if you worked in a clinic that dealt with breast cancer, and you see all these people with breast cancer, are you going to start promoting that we remove breasts from little children?
Yeah, is a foolish point.
Yeah.
Or people say, oh, it's because members of my family 100 years ago had issues for not being circumcised. My great grandfather had to get circumcised. I was like, okay, well, my dad had appendicitis and he had to get his appendix removed, and I'm his direct relative. Well, crap, I better get my appendix removed before it kills me.
Yeah.
It's like, I have appendicitis, therefore I don't need it removed.
Yeah. Oh, and then the hijacking the discussion to ask about your stance on abortion. I love those. That's just, I mean, it's a red herring argument, but it's like, hello, think about it. My body, my choice. Doesn't that apply to the baby, to the boy? I mean, what about my body, my choice? And then
yeah, you desperately want the baby to survive, but once they're out of the womb, who cares what happens to them?
Yeah. You're fighting for the baby, right? Or you're fighting for the woman. In both cases, it applies to genital autonomy. Yeah. It just blows me away that people haven't thought that one through before they say it.
And I've fought with women about this before. I'm like, his body, his choice. They're like, well, what do you think about women's rights then? I'm like, oh, her body, her choice. What are you gonna say now? Like were you gonna try and fight me about not supporting women's rights? Because I support them too. Like, what now?
Oh my. Accuses critics of circumcision of anti-Semitism as knee-jerk, basically as an ad hominem attack, knee-jerk reaction. I get so tired of being called that. It's like, I'm all for freedom of religion.
Yeah.
So if I'm fighting for a child to have their own religious freedom and to be able to make choices about their own body, how is that anti-Semitic if that baby boy is a Semite themselves? That doesn't.
And in my own discussion with my parents about this, they'll try and bring up multiple points on why my circumcision was justified. And they'll say, oh, it's because you had to match your dad, or oh, it's because we're religious. I'm like, that's nice that you're religious, but as an infant, I wasn't religious.
Yep.
And as I got into adulthood, I'm not religious. But the fact remains, religious circumcision was placed on me, and I didn't choose it, and I didn't choose to be religious. But I can't go and undo this religious circumcision. it's permanent.
Yep.
This decision was made for me. And why? Why? I'm not religious. They couldn't see in the future and say he's gonna be devoutly religious. We better get him circumcised now. It's foolish.
Yep. And then the hygiene thing is like,
Oh, that's a good one.
it's like, okay, so you're worried about stuff that might grow under in that dark place, in that dark space. What the heck happens inside your mouth? What happens underneath your eyelids? Your body takes care of it. Just like what happens in the vagina, your body takes care of it. It's designed to take care of things.
And the women that I fight on this, it's a deeply sexist notion that say, oh, we have to cut them because otherwise they're going to be dirty. It's like, can boys not be trusted to learn and practice proper hygiene the same way girls can? Just, well, boys are lazy. It's like, okay, so now you are blanketing all boys as being lazy and dirty. Immediately, right there, you just confessed to being sexist. And the men that I've debated with this, well, they were gaslit into believing that they were going to be dirty if they weren't circumcised. It's like, I don't know about you, but I would be deeply insulted if somebody told me that you're not capable of learning to wash yourself.
Yep. Yeah, and the same thing is said often when it comes to female circumcision too. Yep. You see it and hear it quite often on female circumcision documentaries and stuff like that. So just have to take the time to go watch some. There's a whole lot of them out there. Tons of them on YouTube. So, offers potential decrease in HPV transmission to female partners as an actual health benefit to the infant. Ignores the reality that many will grow up to be gay. Yeah. So yeah, we already talked about the HPV thing a little bit. There's a vaccine now for HPV.
Yep. And speaking of HPV, I mentioned my sisters when they were 11. Like most people in the schools here, nurse practitioners tell them they have to be wary of intact men because of HPV. That very same week, every single one of those girls received the HPV vaccine from those nurse practitioners.
Yeah, that's funny, huh?
Yeah, riddle me that.
Yeah. Yeah, and the way I understand it, none of these claims have actually been proven by lab tested. Nothing. Everything is correlative, right? They correlate this versus this, by looking at numbers of what has happened. They haven't actually tested things underneath the microscope to see, okay, yeah, this germ interacts with this bacteria, blah 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 blah, right? So there again, they're just claims, and you watch the American Circumcision documentary, and it shows it's like claim. All these claims have been made and debunked over and over and over and over and over again. Now the whole STI claim has been very thoroughly debunked by Canada and Denmark. You think we're going to be done with more claims about the benefits of circumcision of males? I hope we're done. I hope no one comes up with another dumb one.
And the circumcision prevents STIs. Well, last I checked, Europe's rates of circumcision were much, much lower than that of North America, and have much lesser rates of STIs than Canada or America. Is this a coincidence? Probably not.
Yep. And it's one doctor. Going blank on. He's with CHHRP. Oh, I'm going blank on his name right now. But he said, okay, so wear a condom to protect yourself from STIs, or get part of yourself cut off and wear a condom to protect yourself from STIs. Both ways you need to protect yourself. Dr. Guest, that's what I was thinking of. Dr. Guest said that. It's like, you still need to wear a condom to truly protect yourself. So, yeah. So.
And even like, I'm not a scientist or a doctor or somebody that really deeply studies this, but I don't think it would take it would take one of these people to look at a foreskin and say, why would a foreskin increase likelihood of having STI or or the likelihood of transmitting STIs? It's not like it's another opening to the penis, or there's an open wound for blood to be spread. It's flesh. Why would additional flesh increase STIs? Do women with larger labia get more STIs? Do women with smaller labia get less STIs?
But that hasn't actually been tested now, has it? They haven't actually had a study. Why not? You look at this and it's like, this is misandry. Look, it's like, okay, you see all these studies that have been done to try to prove some sort of benefit to male circumcision. But you look at the other side, it's like, where's the studies to prove whether female circumcision is good or not? There aren't any. Why not? Maybe because it's, unethical, but it's ethical for boys to do this with males. Anyways, things just don't make sense sometimes. Makes a specious comparison to ear piercings, vaccines, and baptism. Well, I wouldn't have, if I had a daughter, I wouldn't have pierced her ears without her consent. My sons are old enough, 15 and 16. If they wanted to, okay, have at it. They're, to me, they're at an age old enough where I think that is, they can consent to something like that. A lot of people will say, well, they should be 18 or whatever, but that's a whole other discussion about what the age of consent is for various different things.
And in what way is the severity of ear piercing the same as removal of part of genital?
Exactly.
If you remove an ear piercing, it grows back.
Yeah, exactly.
It will grow back.
Yep.
I cannot look at my penis and say, okay, you can grow back now. like I waited long enough, you can do it. I'm not a lizard. It's not like you lose your foreskin and, well, it's okay, it's gonna grow back.
I feel like I'm at a comedy show. Exactly.
Well, you gotta find humor in this, because if you don't, you get miserable in a hurry.
So some comedians have covered this topic. So it's, I actually picked up. I drive Uber. I actually picked up a comedian one time, and I asked her, well, you ever make jokes about your Uber drivers? And I was like, if you want, you can make a joke about me and talk about how the circumcision book is sitting in the middle of the console. She's like, oh, that's a good one. So hopefully she'll do that in the next one. Vaccines. Well, first of all, vaccines are recommended by medical organizations all across the freaking world, right?
Yep.
It's not recommended to cut off the male prepuce anywhere, really. It's not recommended. I mean, there's the whole thing that people attach to in the AP that says, benefits outweigh risks, but they don't talk about the costs. They don't talk about the anatomy and functions at all. So,
and there's a remarkable lack in the benefits and risk section there, where nothing about it is long-term potential effects. Nothing to be known to American healthcare about long damage from being circumcised.
I know that some anti-vaxxers will say that, you can be long-term damage from vaccines or certain vaccines. They might be right. I don't know. I don't know a ton about vaccines, but if you do a fair comparison, it's like, okay, vaccines are recommended worldwide, circumcision is not. And vaccines add to the body, not take away. Vaccines are pretty well known to not cause any kind of harm. There's some arguments about, there's possibilities of harm, but generally, as far as we can tell, people haven't been harmed by vaccines.
I get every vaccine I can. To my knowledge, I haven't been harmed by any of them, but I have diagnoses from being harmed down there.
Yep.
That there's no disputing it.
Yeah, no, you've removed a vascularized innervated body part. So there's just no way to dispute that fact. It's a
Yeah.
vascularized innervated body part. No doctor is going to say no, it's not. Um, and yeah, vaccines is based off of recent science. Circumcision is from who knows how many thousands and thousands of years ago. I mean, we don't even know because it was happening before written history.
Yeah.
So yeah, not a fair comparison at all. But yeah, I get the whole body autonomy angle of it when it comes to ethics, but it's still a big stretch. And then baptism, my wife actually wanted to have our sons baptized, and I was like, no, if they want to when they're old enough to understand, then fine, but not as babies.
And I was baptized as a baby, and like disregarding the views of it, I was dunked in some water. Well, I was probably dunked in a bathtub again later, and been in the bathtub every day ever since.
Yeah.
And you know what? I don't lose any sweat over having got dunked in the water.
Yeah, you're
It
not
has
missing a
not
body part.
damaged me to my knowledge.
Yeah. Oh. I don't think I've ever run across the baptism one, honestly, but it's fun that it's here on the bingo card.
Oh,
Yeah.
umbilical cord should be added to that today.
Oh yeah.
Oh, do you want to keep your umbilical cord attached to your body?
Actually, for a while, yes. If you actually look at how it works and all, and newer thinking goes that you actually should leave the umbilical cord attached until it at least stops pulsating. Because I think the human body, the birth process is really, really smart. A lot of the blood stays in the afterbirth, or I'm going to look at what you call that part right now. That comes out after the baby comes out, and then it gets pumped into the baby after the baby is born.
I believe that's the placenta.
Placenta. Thank you. Yes, that's right. That's the term. So it makes sense. It's supposed to stay attached, but naturally, it does fall, come off later on, anyways. So it's not an innervated body part.
This brings me back to my lizard point of if maybe if a lizard loses a tail, it might grow back. Well, if I lose my foreskin, it doesn't grow back.
Mhm.
Well, is the foreskin like a lizard shedding its skin and you get a new one? You shed your umbilical cord, you get a new one?
Yeah, that's a good one. Get that. Let's see here. Dismisses the gender equality dimension of circumcision due to axiomatic belief that women are the only disadvantaged gender. Yeah, there's some feminists out there that really can be extreme about this. What do you think?
I have met feminists that were originally strong supporters of circumcision, and I managed to successfully open their eyes after I revealed to them that I also support women's rights. So then they wanted to listen to me, and now they're intactivists.
Mm-hmm. Yep.
But that was a long road to that point.
Yep.
Like I had to prove to them that I support women's rights. And how do you prove to somebody that you support women's rights? But it's like, do you want me to make some posts on Facebook supporting you, or like, oh, this is foolish.
Yeah. Antonek from CHHRP, she's a feminist, and she actually, one of the videos where she did a presentation, she connects the two. Actually, I took that video. James Lowen has the video on his channel, but it's a long video, and I took snippets of it and put parts of that conversation from Antonek onto TikTok. So yeah, I mean, if you're a feminist, then you believe in equal rights. So equal rights to genital autonomy would make sense. Yep. So supporting genital autonomy for males, I think automatically supports genital autonomy for females, obviously, right?
Yep.
So I always say, it's a whole lot easier to just say, no one should have part of their genitals cut off.
I support integrity for all sexes and genders and intersex.
Yeah, rather than trying to say, well, I support genital autonomy for females. That comes across so much different. It's like it's so much harder to justify and be concrete about, particularly when you start looking at intersex. It's like, okay, so females are born with a clitoris, or a new term that's been getting used more, clitoral-penis. This came up, I first came across with Dr. Brian Earp, or clitoral-phallus. And I'm actually trying to get clitoral-phallus added to Wikipedia, but it showed up in a medical paper, in a journal, whatever, clitoral-phallus, because the clitoris, basically, if you become male and during utero, the clitoris becomes the penis. It just grows a lot bigger, right?
Yeah.
So when you're dealing with intersex people, sometimes it's hard to tell, is it a clitoris or is it a penis? Right? So where are you going to draw the line as to whether they should be allowed to get circumcised or not? You're not going to be able to. It's going to be too difficult to do. So if I think that I'm surprised it hasn't come up in a legal challenge yet, but I think the judge in Michigan avoided that challenge by saying states' rights, states' rights, states' rights, and that's how he ended up throwing out the whole case about the Dawoodi Bohra performing female circumcision. So because if he didn't do that, he'd probably have to face the whole religious freedom thing and the whole anti-FGM law and all that stuff, being right as far as cutting the lines between male and female, and dealing with equal protection rights, because that's laws too, right, about protecting everyone equally, not just groups of people. So if you're protecting females, then you also have to protect males and intersex.
Yeah, and one of the points that the nurse had for me last night, she called me a weird anti-circumcision fuck. And I said, well, no, I'm not actually anti-circumcision. On a personal basis, I am opposed to circumcision on my own body. But if a male grows up and decides that he wants to be circumcised for whatever reason, power to him. I'll support him. It's his choice. It doesn't affect anybody else. It's his body.
Mm-hmm. Yep. Yeah. My response to that would be, I am a weird pro-genital autonomy fuck.
Yep. Yeah, you can keep the weird part. You can call me a fuck, but better.
Yeah, I don't care about the fuck part. I don't care about the weird part. I'm fine with being weird.
Yeah, just get the correct.
Yeah. Attacks the sanity, character, and masculinity of anyone who feels harmed by their circumcision. We talked about that already, right? Yeah.
Get over it. It happened when you were a baby.
Yeah. Yeah, but it's still happening to babies. If it wasn't happening to babies today, I wouldn't be doing this right now. I wouldn't be saying a thing. I just kind of treat it like a war wound, or it's like, I have my arm blown off in war or whatever. It's like, I'm not going to go around depressing people about the fact that I'm missing my arm.
Yeah.
I'm not doing this to try to depress people. I'm doing this to try to protect children, to protect the next generation.
And why do you care? It's not your child, or it's mind your business. It's like, okay, but where do you draw the line there? Do you care if somebody goes and gets their son a tattoo, or that is unethical, or what if, or the women that say I never liked intact guys because they're is weird or it's gross, so I'm getting my son cut. It's like, there are men that pick on women for having unsightly labia. Is it right for these men to go and take their daughters and have their labia customized to their personal preference? So it's not the same thing. It absolutely is the same thing. And that's just a loss to them.
Yeah, ethically, yeah, absolutely. Morally, absolutely, same thing.
Oh, and then I say, you're putting your own sexual preference on your child. It's like, that's just sick. You're just a sicko for saying something like that. It's like, you literally just said you don't like men that are uncircumcised, so you circumcised your son.
Yeah.
Like, incestuous pedo vibes is what I'm getting from that.
Yep. All comes down to control. And the same sort of thing is used when it comes to female circumcision. In certain countries, they want to be able to sell their daughter, and get that, trade for that goat and cow and other things or whatever. They want to make sure that their daughter can be handed off to a husband or whatever. We're just as bad here in the United States. We want to make sure our boys will get blowjobs and find a a wife or whatever.
Yeah, I'm doing this for his future wife.
Yeah, you don't know what a future wife is going to like or
Yeah.
want, and
Or
you're a perfect example.
Yeah.
You had a date with one woman, right? And
yeah,
yeah,
I've met lots of women here in Canada that prefer men that are intact, because and largely because these women have issues with their vaginal lubrication, and it's of course it's well known that a circumcised man's penis acts like a scraper, and it just shovels out the moisture.
Yep.
Just dries them out.
Rather than doing this, I get that
Yep.
far into the vagina without any friction. How about that?
Yeah.
And all that's lubricated too. All that was on the glands that came down on the shaft. The glands and that was all lubricated.
Yeah. Or the women that I've dated that prefer intact men. The other thing is, some women like performing oral sex. It makes them feel good to make a man feel good, and it makes them feel bad if a man like myself that is circumcised can't get anything out of it.
Yeah.
They want, like, I've had girlfriends that want to pleasure me in that way, and I can't enjoy it. I can't, and that just makes them feel sick to their stomach.
It's depressing. And who wants to be with a person that makes them feel depressed? Yeah. So it's not just harming those of us that got cut, it's harming our sexual partners.
Yes.
We all get hurt by this. Expresses concern for parental religious freedom while neglecting the severity of the physical indoctrination and the effect on child's religious freedom. We kind of covered that, I think, multiple times now, right? It's like, what about our religious freedom?
Yeah.
Where, I often say, it's like, I'm a big fan of religious freedom. My religious freedom was stomped on when I was an infant, and I'm serving a life sentence because I'm stuck in this body for the rest of my life.
Yeah.
How is that really any different than being stuck behind bars? Testifies that everyone in their family is circumcised and that we are all completely fine. I used to think that I was completely fine. You thought you were completely fine until you were age 20, right?
I thought I was born this way till I was 20.
Yeah. I thought that was, certain things were going on. It's like, that doesn't feel good or whatever, particularly when I had, a strong erection. And one of my biggest problems was, because I have a tight erection, my penis will arch upward when I have an erection because this gets too tight. So it acts like a crane.
Mine curves to the right.
Okay, so you're cut too short on one side.
Yeah.
So I'm cut too short all the way around. My scrotum goes up and my penis curves like that. And the problem with that is any guy should know this. When you have an erection, you don't bend it. Doesn't feel good to bend it. This is bending, right? Like this. And then I had one partner that obviously had an intact partner before me, and she tried to do things like this. And that I couldn't do it. I couldn't do it. It hurt too much. I had to say, no, stop. So and she didn't understand why. And she had been with other partners. So well, now I know why. I didn't get that until many years later. I didn't understand that was the fact that I was missing that extra tissue that allows my erection to occur properly. So yeah, I thought that was perfectly fine. It turned out, after studying the the difference is I'm not.
And there's studies that show circumcision causes erectile dysfunction.
Yeah, 4 times more
that's
likely or something like that.
Dysfunction may not know that it could be related to being circumcised.
Yeah. Yeah. And then the last one on the bingo card, bingo, expresses parental concern about possible locker room bullying, even though circumcision rates are lower than ever. I've done so many videos on this complaint. I just respond to people's comments about this, and it's basically 3 things. Don't be your child's first bully. Don't teach them to give in to bullies, and teach them that consent matters. This is simple parenting 101, people.
I can, like, I was circumcised, but not because of a bullying thing. But my name was changed out of a bullying thing at a young. My birth name was Galen, but this is the 90s, and even Canada then had a rampant homophobia, and my parents felt strongly that in locker room talk, well, Galen, part of it sounds like the word gay, so that I'll be called gay.
Yeah.
So when I was 3 years old, they changed my name to Braden.
Wow, I didn't know that about you.
Yeah.
Wow.
Yeah. They made it but they gave me it as a middle name, so they didn't totally get rid of it.
Oh, okay. Braden Galen. Okay.
Yeah.
Yeah, I heard that Canada recently passed some law or something that was pro pride.
Yeah. That wouldn't surprise one bit.
Oh, yeah.
Our federal government at this moment is very well-known, strong supporter of the pride movement and LGBTQ+.
Awesome.
Like, speaking of which, the year I discovered circumcision, I reached out to CanFap. That's the Canadian Catholic movement.
Yeah, I know who that
and
is.
It was pretty fresh for me then. I was a month into discovering circumcision and just felt really miserable. They invited me to come speak, like in front of a crowd, in Calgary, Alberta, for Pride Week, and our Prime Minister happened to be there, and the man in charge of CanFap tried to have an interview with the Prime Minister, but he was in avoidance. He was just playing it off.
Yeah.
And I would have loved to go to this, and I regret having not gone. But at the time, I was just getting into asking local women, about their opinions on circumcision, and I was getting attacked and slandered and ostracized left, right, and center. And then it became very clear to me that I was not going to be safe socially or culturally if I went to this and spoke on the news against circumcision. I'd return home and find myself shunned out of society and made fun of. So I didn't go.
Man, I'm sorry.
And now I wish I would have gone, because I'm beyond caring anymore.
Yeah.
I've been so driven with anger about this topic for the last 4 years that I don't know if I care about being ostracized or attacked or slandered. It doesn't matter anymore.
Yeah. Oh, well, I'll support you anywhere I can. Sometimes I wish I could fly around and join people that want to speak up or are too afraid to do it themselves. I know that a lot of people have come out with me. The same thing has happened with Brother K. He says he told me this is like speaking out himself has given others the permission to speak out, and because he's been out there wanting to get out there, others have rallied around them and also spoke their piece. So.
And for very recently in the last month, I had an hour-long phone call with a nurse from a nearby hospital, about an hour away, where they happen to perform circumcisions because they have a religious doctor on staff, and she enjoys performing circumcision. She's 22 years old. She genuinely enjoys it, and I had to keep my cool, because the phone call, I played her off for a long time. I wanted to find out how sadistic and vile she actually was. And
hang on just a second, Brad.
It's all right.
Okay, sorry about that. Keep going.
It's all right. Okay, so I baited her, and her own words were that she loves getting to hold down the babies, and she thinks it's fascinating watching the Gomco clamp get used. And I'm learning all, and I'm hearing all this, just like, oh, that's interesting, like just playing it off just as best I can. And then after this long phone call, she says, well, I want to know your opinions on it. And I laid into her.
Did you?
I told her how I feel about it, what I think of her, uh, what I think of the healthcare system that she exists in. Like, I really gave it to her.
Good.
And then I went off the deep end after that. I was so full of rage, just engulfed in rage. It consumed me, that I didn't care about my image anymore. Because previous this, I didn't want to be associated with intactivism or circumcision, because even I've met women here that are against circumcision, but they still think it's weird to be passionate about it or to be an activist about it. It's a turnoff for them. And as a single man in my early 20s, I didn't want to drive away women, and I didn't want my friends to think that I'm some weirdo activist.
Yeah.
So I never went public about it. Did all my intactivism in private.
Yeah.
But that nurse pushed me over the edge.
Yeah.
And that is when I contacted every intactivist that I knew. I said, I'm gonna need support. I'm gonna go public on Facebook for the first time. I'm expecting a bloodbath.
Yeah.
So I made a post, and there was such overwhelming, wonderful support from intactivists.
Awesome.
That, for lack of a better way of putting it, it kept the haters away. That was well, pretty cool.
Actually, only two. I don't know if you saw there was a tweet that happened yesterday or the day before. It's a big show that happened. I'm going to blank on the name right now. It's a nighttime show that happens, and he tweeted asking whether circumcision should be made illegal or not, and it ended up getting a majority of yes, it should be made illegal. And all the comments, the last time I looked, all the comments were definitely pro intactivism. Now there were some that showed up that were pro circumcision. All those ended up getting deleted.
Oh,
the people I think were too embarrassed to be supporting circumcision. It's like, yes, that's the way it should be.
That's a win.
You know, get them running. The tables have turned.
I shared that poll with a lot of people in a small amount of time, because when I first looked at it, the numbers were concerning. It was like 75 to 25, 75% in support of not banning circumcision. Just I've got to change this. So I started sending it, rapid firing it to everybody I know that might care.
Mm-hmm. Yeah. Yep. So anyways, Braden, I want to say thank you for being real here. And I was going to say earlier, hopefully you know that when it comes to relationships, if you want to be in a relationship for a long term with someone, you got to be real. You have to be true to yourself. You have to be, real about who you are and all that. And if the person doesn't want to be with you because you are real, the real person that you really are, and your real feelings and everything like that, it's going to come out later on in life, because you can't hold certain things in for too long. Because at some point you're going to want to be your real self. So, I'm 17 years now with my current wife. So, but I want to say thank you again. Thank you for your advocacy work. As a father that was going to have his first son cut, I am so thankful for Intactivist, and for all you women out there that are helping us out, because you're not as traumatized by speaking out like us victims are. Thank you. I really appreciate it, everyone. Got anything else to say, Braden?
No, thank you for having me. I haven't done anything like this before. I've had some phone calls with intactivists, but few and far between. I realistically don't have any interaction with intactivists other than through a keyboard. Because I'm in a part of the world where there just isn't very many intactivists because there's so few people. I'm kind of alone out here.
I hear you. I hope this was recharging for you, and
Was
I'll keep an eye out for anyone else in Saskatchewan. I'll be contacting you about the other. I know at least one. I don't know of anyone else in Saskatchewan, but I know several intactivists in Canada.
Yeah.
So there's one I want to get you in contact with. So I'll be chatting with you about that.
okay.
So otherwise, we'll wrap this up.
Thank you very much.
Have a great night, man.
You too.